So, Adrienne, are you?
Yeah. Well, so first of all, wanted to welcome everybody to the session on Community Pathways 101. We're so happy you're here. Hope you have been enjoying the beginning of the statewide prevention conference. And Ron and I are excited to co-present today. Um, so I'm Adrienne Shilton. I'm Senior Vice President of Public Policy with the California Alliance of Child and Family Services. And we represent nonprofit, community-based organizations in every single county in California, working together to serve our vulnerable children and youth and families in public systems. And I'm joined by one of our member agencies, All for Kids. And so, Ron, pass it to you for our intro.
Right, thank you. I'm Ron Brown. I'm with All for Kids, based in LA and Orange County, but serving a lot of the state in many ways. And delighted to be here, delighted to be engaged with all of you, and to really kind of look at this topic as one that I think everybody kind of needs to know for the future, which is why Adrienne and I volunteered to do this. So I'm going to shift to the next slide. And really, like, who is this workshop for? So really, this is for those people that don't know anything about a thing called the community pathway, or they've heard a rumor about it, but that's kind of it. Uh, or better yet, I've been put on a committee about community pathways, but I don't know why or what's the best way to make a difference on that committee. Or I've been doing some work on community pathways, but could use a refresher and to really understand what's the long-term vision of this work. So we're going to take a very casual and relaxed approach to this. We're going to trade off. It's really kind of casual and just real simple. But we did call this Community Pathways 101. So what does that mean? Well, yeah, we all hated those classes in college. And in some ways, this is similar, the big old sections, and this is a big room, and it's a basic topic, and we're going to just do some basic work. The good part is there aren't any TAs in the room, which means there are no separate sections that you have to take, and there are no exams. So you have no exams here. So I'm happy to assign an essay to you if you'd like, but just know that if you decide to write an essay about community pathways at the end of this, you're going to get an A anyways. So when you think about a 101 class, this is just that kind of basic understanding of why. And our hope, really, in some ways, is to arm you with enough information to be both successful and perhaps a little dangerous in your service area. Okay. So really, what is a community pathway? What is this? What is this thing called a community pathway? So you've been hearing about it, or you probably wouldn't have come to this section. You heard something, but you don't know. But there's been a lot of talk about community pathways. We're going to get to the real basic background of it because we want to make sure that you fully understand what it means and what it is and how it came about, and provide clarity going forward. Meaning, hopefully, to avoid potential confusion. So we're going to go back a few years to begin with to see how the term really emerged more prominently into our nomenclature, into our language. How did this thing come out? And to do that, we need to first go back to the FFPSA, the Families First Prevention Services Act, that really helped kind of establish the concept in our language across this state in community pathways.
All right. You're passing it to me now, right?
I am.
All right. Okay, so now we're getting into some details about FFPSA. What are the evidence-based practices? What does community pathway mean in this context? So I think as all of you know, in 2018, the federal government changed how states can draw down funds from Title 4B and Title 4E programs. And so every state was required to submit and get approval for its own plan related to this. And so in these new federal requirements, this included the use of evidence-based practices, or EBPs, and the EBPs that California intended to use had to be listed in its plan. And all state EBPs had to be in the federal clearinghouse, not just the state list. So California, then followed the lead of some other states and included in the plan what is known as a community pathway, which is to say a community-based means, a non-governmental or a community-based organization to be the entity to assist in the drawdown of those federal dollars. And many of you were probably involved back then too. So there was a lot of stakeholder engagement. I remember being involved with Ron.
Mhm.
Lots of input from counties, from education partners, from community-based organizations. And California then, after all of that process, submitted its plan, which was approved in the fall of 2023. And so on the next slide, we're going to actually talk about like what are specifically the EBPs in the California plan. So here they are. We've listed them all here. Programs like Nurse Family Partnership, Healthy Families, America, Parents as Teachers. So there were a number of EBPs that were included, and we have all of them listed. And it's really important to remember, and Ron and I have been talking quite a bit about this, is that the criteria to deliver each one of these EBPs is restrictive. And each one is intended for a very specific population as well. So how does a community pathway or CBO provide these? Well, they need to be contracted with a Title 4E agency, so either child welfare in this case or probation to deliver the evidence-based practices in the community. So the CBO, the community-based organization, would then be delivering these services in adherence to the model with fidelity standards. They all have them. And then this is the pathway to allow the families and communities to receive these services on a voluntary basis. So that's some background about that. And then there are the county prevention plans. Um, so by now, almost every county, maybe all of them, Ron, but almost every county has established a prevention plan that is required by the California Department of Social Services. And all of those plans can be found, I'm putting the link in the chat right now, on the Caltrans website, which is right there. Um, and most of the counties, as you're going through that list, included a community pathway in their plan. Um, and so this, will be very useful for you all to be engaging and understanding what is in your county's prevention plan. And you can know more about how they're thinking about this, if community pathway is included, and sort of what their thinking is about how this would be implemented. So to reiterate on next slide, what's a community pathway under FFPS? Well, slide 9. This is the avenue in which children and families can receive early intervention services at the earliest point possible to minimize, crisis, to minimize longer term adverse outcomes. So this vision that we have included here on this slide is a beautiful one. And this is kind of where things stood in 2023. So using a community-based approach, like a community-based organization, the state and county can then draw down federal funds and begin implementing an evidence-based practice that is listed in the state and the county plan. So
So, and just
yeah, go ahead,
sorry,
Ron.
but just to reiterate, we took this directly from the state's plan. So this is
Yeah.
what's defined, why it's in quotes. This came right out of the state's plan. Normally, we would not have put this many words on a slide, but you have access to these slides afterwards too. But this is what is exactly out of the state's
Yes.
plan and the language that they used.
Yes, exactly. So the community pathway is a trusted, trained and trusted community-based provider that is contractually, has the ability to deliver one of these approved evidence-based practices. They can meet the fidelity to the model, so the county can then bill the state, and the state can then bill the federal government. So we included a graphic on the next slide about like how all of this can look um, in, on paper, how this can all look. Um, And so, again, ideally this starts from, the need, the family and needs of supports and services to then be, have the intake to then determine if they're a Title IV-E agency. They're determined to be one. The prevention plan is completed by the service provider, and then there's a coordination and delivery of services with continuous oversight and monitoring as well. That's the fidelity. So this is we just wanted to put like graphically what this looks like in practice.
So it might be helpful. We're going to keep talking about community pathways, but we're going to talk about another version, if you will. So, Adrienne, because I have this up, I can't really. Do anybody have any questions at this point? Is there anything that you want to throw into the chat? A question that we should be looking at based on this intro to community pathways, the first kind of way it evolved into our language across the state. And it was, again, driven by the feds. Title IV-E is what's drawn down to take foster care and adoption work. Title IV-B is PSSF, promoting safe and stable families, and how you draw down funds in your counties and how agencies can provide services, et cetera, et cetera. It's like the state did a whole, like we did the continuum of care reform. This was the federal version of the continuum of care reform that we did in 2016 in the state of California. This is what they did in 2018. But any questions that people have before we move on to the next iteration, and just as important, in some ways, almost more important.
There's a great question in the chat. I'll read one. There's a couple actually, but the
Thank
first
you.
one I'll read is, am I understanding that the pathway can only be one community-based agency? It couldn't be spread across multiple local entities providing multiple EBPs. There can be more than one. There can absolutely be more than one. It would be very unlikely that one CBO could maybe even do multiple EBPs. That's, some of the larger agencies might be able to do that, but there absolutely can be more than one CBO and likely will be in terms of the expertise needed on each of these specific evidence-based practices.
Yeah, great question.
Great
Thank you.
question,
And
Emily.
absolutely right, Adrienne. And again, you saw all those evidence-based practices that were listed there. I can slip back if you want. Like nobody can provide all of those. And it can't even pay for all the training for their staff to get those, let alone.
Yeah. Okay, Ron, there's a question about this slide, just looking at the different steps.
Uh-huh.
Any CBO that is qualified to provide the EBP and has a contract with child welfare or probation can deliver the steps 2 through 6, which that's the intake.
Yes,
Looking at your
that's right.
slides.
Yes.
Yes.
Under contract. Yes, that's a contractual arrangement. Yes, absolutely. And it is the way that both the state and the counties drove this because the original FFPSA plans didn't include a community pathway. And as they started to emerge across the country from other states, we adopted this in the state of California because it meant all those services were going to be delivered by government entities. And of course, in California, you're talking New York and Massachusetts, where you have a whole lot of non-governmental entities providing services. They're like, we can't do all this work. You're going to blow this all up, and it puts too much pressure on our systems. So the community pathway language emerged, and that's exactly where it's going. So the oversight and safety monitoring does come out of the government entity that has the contractual arrangement.
Great. And more questions come in. We love
Great.
this.
Yeah, we've
Keep
got
them
time.
coming. Okay.
Yeah.
This one is, can the protective factors survey be a way to measure fidelity standard?
No. So the protective factor survey is a great way to measure outcomes for families and the services that you're provided, but they're not adequate when it comes to an evidence-based practice. Every evidence-based practice has its own methodology and its own criteria, and those have to be specifically managed. The unfortunate part of FFPSA was that the federal government required that all the evidence-based practices that states adopted had to be in the federal clearinghouse. So if you've looked at the federal clearinghouse, it has about 1/3 of what's in the California clearinghouse. The California clearinghouse has a ton more that are broader, that are more adoptable to specific populations and demographics. The federal clearinghouse did not. And so The state had to cherry pick what it could and still have to. We all hate anybody that delivers an evidence-based practice. It's important, but we hate this concept of fidelity to the model. But that's really the words that you have to stick with. It's fidelity to the model, and that's what you're going to be. You're going to have to show evidence for, because again, if you can't show that evidence, you're not going to get reimbursed.
All right. This next question, is the community pathway available to only Title 4E candidates?
Title
Yeah.
4, well, under FFPSA, 4E and 4B, but only within that structure.
Within the structure of the plan, right,
Right,
Ron?
within the structure of the plan. That's right. So,
Does that make sense, Jennifer?
yeah, so wait, so we're gonna have to stop for a second, because we are gonna get into another version of what it means to be a community pathway. So, under the conceptual framework of FFPSA, absolutely, that you're right. But we're going to talk about another way, another methodology of community pathways and community engagement too, in just a minute. But I want to, and that's why we want to do this workshop, because the language under community pathway is twofold. It comes in one window, FFPSA, and it comes out of another one that we'll go to in about 5 or 10 minutes, depending on the questions. And
Yeah.
so hang on to that question, and then see
Yeah.
if it's answerable after we do the next section.
I think this next question, Ron, does make sense for this section. Just I think we can answer
Yeah.
it pretty easily. Does the referral to these agencies, so like the CBOs, I'm thinking, have to come from a Title 4E system? Can families self-refer to these agencies and obtain these services? Like, in other words, who does the
The
referral?
referral structure,
Yeah.
we're not there yet in the state of California. So, to my knowledge, because we don't have the reimbursement structure in place with the federal government. So once that happens, my suggestion would be that that the family could self-refer, but if you're a CBO getting the self-referral, that you check with your government entity that you're contracted with before providing services, or to ensure that they're included in the process. So it's like, if you provide services and you're expecting to get paid, even if it's under an evidence-based practice, but the government entity that you're contracted with doesn't know that, I don't know if that's a good thing at this point in time. And we won't have that kind of hashed out until the reimbursement structure is finished. It's supposed to be done in the fall of this year. So it's taken already 3 years for this reimbursement structure to get put in place in the state. So yes, and your counties, if you've been providing these services under FFPSA in these evidence-based practice, can back bill the state, who should be back billing the feds, all the way back to October of 2023. But I don't know about the self-referral being, when it comes to reimbursement, I would worry about that at this point. So if you're a government entity, I would be really clear with your contracted agencies to be clear. You can, if there are certain criteria, you can waive it in a contractual arrangement to say, if the families meet this criteria, automatically they fit, and then you've already given them that in their contract. But I would make sure that it's contracted. As a presidency of a CBO, I would want to have that in my contract before I delivered the service.
Yeah.
Or
I
at
think
least,
that
or at
sounded
least
fine.
we're always going to do the first part of the service. We're always going to help on the front end. But before we start doing, an evidence-based practice is delivered over time. So before we really got into something heavy, we would want to make sure that we had permission to do that, and not just from the family.
Great. Michael's asking if the county does step 3. Yes, that's county child welfare or county probation.
Yeah.
And then I love this question. I think we're going to get into this a bit too in the next section, Ron, but how do we find out how decisions are being made in terms of contracting, in terms of who the community-based organizations are, in terms of what's happening at the local level in these county prevention plans? It's a great question.
Yeah, it's a brilliant question. And how many counties do we have in the state?
58.
And how many county plans do we have? 58, and every county is itself. So why Adrienne put on in the Caltrans website the access to your county's prevention plan, you should look at that. because it'll be defined in there. Every county is every county. And so you can't make assumptions just because, like for agencies like mine, where we work in multiple counties, we have to handle each county differently. And so really thinking about this in a different kind of way is like you kind of have to make sure that you're normalizing whatever criteria that you're having permission in the ways that you need to, but the criteria in the front end is pretty concrete. And then we will be talking about criteria for engagement in the next section of the discussion in just a minute.
So I
What?
think some of these other questions we're gonna be tackling, Ron, but
Okay.
I'll monitor just in case. But I think we got through a good chunk.
Okay.
And I'll pass it back to you for the next set of slides.
Okay. So not to screw things up or to muddy the waters, and actually to really provide some real clarity and to create ease and for a lot of really, really good reasons, which I'll get into in a minute, that we've introduced a concept of community pathways under the introduction of mandated reporting to community supporting. So MRCS, which is, this is a transformative approach that shifts reported suspected child abuse to connecting families with supported community-based org resources to ensure safety and family well-being. Again, this is right out of the state's website. The whole point of this is in late 2022, AB 2085 and SB 185 were signed. And in essence, they modified the definition of reportable general neglect, again, general neglect, by clarifying that economic disadvantage is not general neglect and that a child must be at substantial risk of suffering serious harm or illness, and specified that poverty alone is not a reason for the court to take jurisdiction and for a family to enter the child welfare system. So, again, what this does is it creates a, a new methodology for all the mandated reporters going all the way back to the early 80s and how we're looking at mandated reporting. And everybody that's a mandated reporter now has a qualifier. And that qualifier really becomes to this conceptual framework of substantial risk of suffering serious physical harm or illness. And that when it comes to financial economic disadvantage, that doesn't necessarily throw a child into the neglect zone. So big words in a difficult to navigate system where reporting of any kind really is the de facto approach, since not reporting can lead to the loss of one's livelihood. So, you know, you're like, well, I'm a mandated reporter. I'll share you my best example is my daughter's a high school teacher. And so, like, I get a call from her quite regularly, once a month, once every other. Dad, I get this kid. Blah, blah, blah. Like, okay, well, talk to your counselor, but she knows if she doesn't report, she could lose her teaching credentials, and that's her livelihood. And many of you on the call are in exactly the same boat. Most of you, maybe not Adrienne, because and Michael, but I am. So if we don't report, we're in jeopardy. And so this really does give latitude to consider this one slice, right? One slice, because what's happening across our state? Economic disadvantage is really prevalent across our state. And what happens then is if you have a mandated reporter and a kid comes to school day in and day out in dirty clothes and hungry, you may decide that there's some neglect going on and you might report that kid. So what happens to that kid? Enter into the child welfare system, and that sets a whole new path. And of course, let's not talk about the demographics of the people that are being reported. Let's not talk about how these generally are young black men, by the way, that are getting reported in the schools, or young black kids. So how do we make sure that we're looking at this in an equitable way, and that these two bills were a way to really look at this and to set up a task force? In 2023, a task force was established, and in 2024, recommendations from the task force were presented. So the idea of these conceptual framework of how do we help these kids. So I talked about a community pathway. We haven't talked about it under this yet. So just that's this. But so where's this? Where is the piece? What does this mean? So it means, as a mandated reporter, what alternatives to reporting do I have? This approach allows for a reporter to refer the child or the family to a community pathway when they deem that the child is not at substantial risk of suffering serious harm or illness. So, essentially, we're using community supports for a family in need when the risk is low. In addition, this will help keep families together, strengthen community and community connectedness, keep children off the child welfare rolls, and address the historic racial disparities that overreporting in our systems occurs. So it's a way to take a slice off the amount of reporting that goes into our systems on a regular basis. So some counties across the state are piloting projects that use a decision tree to help mandated reporters identify families and that will benefit from this approach. So what's this mean? It means that we're working on some processes. There's actually a bill to get some additional funding right now to pilot a few more of these things, and the pieces are twofold. You have the risk management standpoint from a mandated reporter. How do I mitigate risk management? I mitigate risk management by using a government established or approved tool that is a decision tree that allows me to conclude that the child is not in substantial risk of physical or serious illness, physical harm or serious illness. So through this decision tree, and I know that there's a couple of them being piloted now, and hopefully we'll be able to broad base these more across the state as they get proven and get more used. But again, it's the whole we all know what a decision tree is. Is this happening? Yes, no, this, no. And it comes to a conclusion. And if that mandated reporter used that decision tree and can evidence the use of that decision tree, which means they have to log it in, etc., then they are not at risk of losing their credentials, license to work, and all the rest of that if they don't report this child. But they have to instead report that family to a community pathway. So there has to be an outlet for that family. Because right now, if you're a reporter, okay, I don't want to report and I've done the decision tree, but where do they go? Well, they go to a community pathway. So now what? So what happens now? Okay, so once again, now we're bringing back community pathway one more time. Now we're talking community pathway in a different kind of light, and yet the irony is they can be the same organizations, not necessarily, but they can be. And I will tell you, I'm gonna pitch right now, just so you know. In the next section, you're gonna have community pathways 201, which is really gonna talk about how it can work, showing you how it works in an agency, really getting good evidence about how a community pathway can help families that have this kind of need that allows the reporter to have confidence that they're going somewhere. And this is the 201 is like this is what it's like in action, and it's really going to be cool. So if you have that question after this and there isn't another one that you want to go to, or that you want to really get a better understanding this for your county, definitely go to Community Pathways 201, because now Adrienne and I are talking conceptual framework, and we're trying to give you the basis of this understanding of how these things flow and work. This is how they can work. You're going to get a good example. So, okay, I get it. Now what? Well, once again, the emphasis is on the community pathway. Is it the same thing? How does it come to play in this very different perspective? Yes, those are definitely the right questions. While the answer is the same, the context, of course, is very, very different.
And Ron, there were some questions that came in on this
Okay?
last
Yeah,
batch of slides. Do you want to take some?
we're perfect for time. Yes, you bet.
Great. So one of the questions was, are there sample decision tree templates available for review?
Uh,
And
I
then also kind of a related question, how do we find out which counties are piloting decision trees?
Okay, that's a good question. I will tell you what, Michael, let's since you're here in our tech support, let's go ahead. We know where those are at. We had the again. There's a statewide community pathway commission group work group. We can figure out where those are, and we can get it posted back out through this context in a follow up, right? So where I know that LA County's got two of them. I believe Santa Clara had one. I thought there was one going on in San Diego. Um, Maybe one in Santa Barbara. I mean, but I haven't really tracked them other than the fact that I know that there's a couple, two different versions being piloted in LA County for sure. But I want to give you more than that. So we'll figure out where those are and be able to get back. What else?
And there was some question about, again, just maybe going over again, like explaining how the MRCS is a community pathway.
Okay. Um, I think that's the next slide. So that's where we're gonna
Okay,
get.
okay, yeah,
Yeah,
that's right. It is.
yeah, yeah. So
And then this pathway about CBOs getting funding and reimbursement, that was also another question here.
right, can they get reimbursement? Yes, they can get
Yes.
reimbursement. Uh, can they use current funded structures? Yes, they can. There are a number of ways that CBOs can get reimbursed. They could even be reimbursed under FFPSA for the same kinds of things. So I know that motivational interviewing is a key component in this. That's an evidence-based practice under FFPSA that could be also very, very helpful in the delivery of an MRCS family. So yes, there's opportunities for reimbursement for CBOs under this model, and that I would be remiss to say, you also have organizations that function as family resource centers because when we get into this, we're going to talk about trusted community partners, and there aren't any better ones in the state of California that people don't talk about than the family resource centers. And many of them already have funding sources or are already doing some of this work. So what we're trying to find for them is some additional funding to take on some additional efforts or to use the new funding structure under FFPSA if possible. What else? Did I miss any? Are we missing anything else, Adrienne?
Let's see, a few more came in.
Yeah,
I'm
yeah,
just trying to
okay.
make sure
Yeah,
because
we're
we're
good.
covering some of these in the next section too. Um, so it seems like the first pathway for those supports, in the existing system and not new CBOs, but the second may include a broader base of CBOs that are more grassroots. Am I wrong?
Uh, um, am I wrong? No, but you're definitely on track. You're not wrong, but I mean, so we will talk about like particularly if you talk about you go to the 201, you're going to talk about community engagement and the impact of community being part of the process. Community supports are critical to family supports and child supports. So you're going to see that that's going to be a component of whatever is going to be successful for the family in the context that they're in. So because we have people from all over the state, we know that the context that we're talking to today goes from the densest population in LA County to a very, very rural community. So how do we talk about community supports in Siskiyou as opposed to downtown Los Angeles? And so they're going to be different, but it's still going to be based on community supports as well. So how do we surround a family with community supports? And that's what, in many ways, what that whole component, we had the question about the strengthening families model and how important social connectedness is. So social connectedness is just as important in a rural community as it is in an urban community. And as we move into MRCS, the community structure really does play almost a bigger place than it does in the FFPSA structure.
Here's another great question. If a family is referred through the MRCS, does the family still need to meet candidacy in order to get the reimbursement? Or that's their understanding, correct?
Um, so a family coming under MRCS isn't a family coming under FFPSA. So they're different. And so the reason behind them is different. Can they get candidacy? Absolutely, they can. If they qualify, they qualify. It doesn't matter how they get directed. So the point of FFPSA was to provide methods for drawing down Title IV-E, Title IV-B funds, and to do that through community-based organizations as well as government entities. But MRCS is really around safety valves, and we'll talk about safety valves in a minute. And so funding, yes, is possible, 100%. And there, one of the things that I've been working on probably for the last 3 years is like how do we strengthen agencies, CBOs, and the community networks of organizations so that they have the tools to draw down additional funds through FFPS, even if they're serving families under the MRCS component. And so how do we get them trained? And one of the things that I use, I mentioned motivational interviewing, and I say that only because it's a great tool, but it also has a train the trainer model. So one of the things that happens with an evidence-based practice is you have to be trained on it, and they're expensive. And not all of them include a train the trainer model. So if you have a train the trainer model, then you can train your own person in your own entity and have them do the training as opposed to having to hire the entity that owns the model every single time you have change in staff, which happens a lot to all of you, doesn't matter who you are on this call. And so really having an internal model or internal structure for additional education means that you have continuous eligibility as opposed to everybody that had this left us and now I have to get somebody else trained on an evidence-based practice. So we can do that like FRCs, family resource centers. How do we educate them? How do we train them in these evidence-based practices so they are a resource because they're already there. They're already trusted voice for and with community.
I wanted to thank Alexandra in the chat. They added a link to Santa Cruz County's decision tree. I
Mm,
was just pulling it up
brilliant.
here
Oh, yeah.
to look at this.
If I could figure out how to have a heart come up out of my thing right now, I'd be sending it. Thank you. Yeah, no, great. Good. So we know Santa Cruz for sure. I thought there was some, but I don't know. I have been a little less connected with that piece of it lately. So
I
great.
don't know, Alexander, if you wanted to say anything about this,
Yes.
but welcome that if you wanted to come off mute. But thank you so much.
Yeah,
While waiting.
thank you for acknowledging my message.
Yeah.
I like the link that I sent because it's a PDF of like an actual like brochure that they recently shared at a child network symposium here in our county. And so I
Okay.
thought it was great to share as some of the links were just kind of more of a verbal talk out way. And so the other thing that our county shared was that there wasn't going to be like a specific trainer that we can all as CBOs like get a hold of and get trained, but it was going to be something that we all collectively learned and will continue to like work on internally to support our staff.
That's wonderful. I so appreciate you sharing that and conceptual framework. And what this tells you, though, this is all a work in progress. Right now, we're in the middle of all this, all of it, because we can't build FFPSA yet, even though we've got a plan and all that. We can't. MRCS isn't evidenced out yet far enough, although it's being tested, and people that are using those tools are no longer at risk at this point in time, even though those tools haven't gone further. But they've been given the clearing by their legal counsel in order to invest in learning how we use these. So why don't we go ahead and shift then to the next slide,
Yeah.
Adrienne, which kind of goes into community pathway under MRCS.
Yes. I'm just putting in the link in the chat again. Somebody was just asking for that decision
Yeah,
tree. There
yeah,
you go
yeah.
again. Grisel just added it. Okay, so I hope that we're starting to shed some light on the differences. So community pathway under MRCS is different than the community pathway under FFPSA. Ironically, and maybe this is where things can get confusing, there can be the same organizations, like the same community-based organizations involved in both, right? Doing the work under FFPSA, drawing down federal funds, delivering EBPs, and being a kind of safety net under the MRCS as well. So that's what we're trying to like shed some light on. And we think about like Ron and I were thinking about like a visual or like a way to think about this. And while the pathway under FFPSA is really the potential way to draw down funds, under MRCS, it's more of like the safety net or the safety valve. And so what does the safety valve do? Primarily, it's a way to let off the steam before the pressure gets too much and something goes terribly wrong and we're in crisis. So that was sort of how we're trying to distinguish between the two. And in terms of like that, back to that safety valve analogy on the next slide, like who is this for? Like who is the MRCS for and why? And like for what purpose? So for mandated reporters, so they're not putting their livelihood or their job at risk. For the government, to minimize the number of unnecessary calls to hotlines and the hours, the workforce and capacity to review all of those. For the community to have a safe and trusted space for needed services and guidance. For families, so they can stay together when there isn't a substantiated risk, and the angst and the time and the stress and the trauma to resolve, sort of unnecessary interactions with government and with the courts. And finally, for kids, like why are we doing this? The kids from unnecessary trauma, so that their names are not put into the child welfare system unnecessarily, so they can get the help and so they can stay with their families. So this is like, hope that like helps distinguish the two. Realize it is confusing because it's the same term. And again, the organizations, like many organizations in the Alliance Network, are involved in all of this work together, and sometimes it's even the same families, same organizations, same families, and can kind of come in and out of like both kind of programs in our state. Ron, what would you add to that?
Yeah, I mean that is and that this is the very reason we said we do this workshop and why we wanted to kind of sow these seeds before you went into 201, where they're going to talk about the MRCS approach, but also the bigger community pathway approach in a more detailed way that they can kind of show you how it works, like really on the ground, how it works and work through this. But we want you to be able to walk away from this, and we'll get to key points in a little bit too. But like there's two different things. All of a sudden, community pathway was here and it's coming up. And how am I getting these confused? Am I getting these confused? And the answer really is yes and no. So that's the harder part, is because when I talk about a community pathway, is it a CBO? Yeah, basically it is, or a group of CBOs, or an outlet of organizations, or an FRC out there that could be multiple organizations working collaboratively. And yet their approaches are very, very different. But here, as we're talking about MRCS, this whole concept of a safety valve is really critical. So where do you go? Where do you go? Where do you yourself go when you're going to blow? If you're a mandated reporter and see a family in need, what do you do? What do you do? So take a second. I'm asking you to just take a second, pause, reflect on where you go when you're hitting a wall. Uh, where's your safety valve for yourself as a person? This is self-care moment. So do you go for a walk in nature? Do you talk to a friend or a loved one? Do you go to the gym? What do you do? And not everyone has access to all of these. So where do families go when they're hitting a wall? What do they do when they're in need? So take a second.
Please keep the questions coming or comments.
And then I'm going to say, so in your area where you're at, what organizations exist in the context of the families that you're working with? What organizations can help? Are there family resource centers in the area? Do you have other trusted partners? Perhaps even a list of organizations that your county has organized, or better yet, a technical resource pool that allows you to research easily and conveniently and is set up so that you can affirm that the family has gotten the needed services. That tech platform is a tool that I know is being worked across in many, many places across the state. So, we talk about warm handoffs. How does that happen? How do we do this in the context of a family and in a community? Do we put this resource out for mandated reporters when we get the decision tree so that they have a one-click link that they can go to say, these are the trusted places that my county believes can provide services to a family in need like this. And if I refer them, I can actually follow up and make sure that the family followed up with that. Because another piece to this for a mandated reporter is I make the link, but my obligation doesn't finish there. I just have to make sure that the link was connected. So we can't do the old school, here's a flyer, go to the people down the street or catch bus 22 for half an hour and then walk 3 streets up the corner and go to that organization. We need to make sure that the family did something with it because in order to do that, then we have to look back and say, how do we make sure that? And this technological platform is really what's being worked across the state right now in many, many ways. So it's like, what do you do when you're going to blow? What do families do when they're going to blow? So here's, again, how this might work. A mandated reporter comes across a child or family that has escalating needs and may need to be reported to the county hotline. The reporter uses the decision tree tool optimally, as we said, and if not, their own discretion as to whether there is a substantial risk. A conclusion is made that the answer is no, there is not. The decision is documented, and the reporter refers the family child to a community pathway that's available in the community that the family and child live in and provides the services that the reporter thinks that are needed. The community pathway organization provides a comprehensive intake and directs the family/child to the necessary and needed services and follows up to ensure that those services are provided. That's how that might work. And that's what you're going to get real big evidence in the 201 class today. Gigantic evidence. And again, it's a comprehensive intake because you all know, just like I do, that when a family has one need, they have other needs. And what you're hearing about is the one that's most important to them at the moment, but it might not be the only one they have, and it might not be the only one that's going to spin them out of control. So I'm going to jump then to key takeaways, and then we're going to go to questions again. Is that all right? Adrienne, is that okay?
That sounds good. We're
Okay.
almost done with the slides.
So the key takeaways are this. The words community pathway have entered the world in two different ways and have two different approaches. That's the key takeaway. So first, as a means to draw down federal funds under FFPSA and the state's plan, and then the county's plan as well, because that's subsumed in the state's plan, or they have their own plans, and contracted non-governmental entities providing evidence-based practices under that method. Second, as a means to prevent children from unnecessarily entering the child welfare system by giving mandated reporters the needed tools and a safety valve to decide if there's substantial risk and if not, the community-based resources that the families need. Okay? 1 and 2. 1 and 2. So when we talk about community pathway, I want you all to take that away. There's two methods here, two pieces here. The one that's most pressing that we're hearing the most about right now is the MRCS component, because that's the one that's most alive. But I will say that there are means to draw down funds from the federal government as an opportunity for you to connect with government entities if you're a CBO, or government entity to strengthen your trusted CBOs in your community and to help them help you provide better services to those in need in your community. Let's go ahead and take questions again, Adrienne.
Okay, I want to go back up to a question about.
Should I take the slides off?
Yeah, I think so. Let's do that. It's just easier.
Okay.
And then also welcome people to come off mute too, but I'll continue to read the chat.
Yeah.
But Ron, there was a question about the community response guides that I think you referenced. Do these need to be state approved? Are there required criteria for these?
Sorry, what was that again?
The community response guides?
Yes. As far as I know, because again, they're going to be local to each community, each county. So they have to be approved by the counties themselves. So a community response guide. What I'm talking about was like, who do you go to, right? Where do you go? So the best place, as we have said before, there's contractual arrangements for FFPSA. But who are the best people? When I went to, who do you go to when you want to you're going to blow your safety valve? What organizations do you reach out to on a regular basis? What organization does your county? What do you as an organization connect with the county to evidence why you're a good agency that they should be working with in this? So they're going to be either contractually or at least alluded to in some ways, and then contractually if it's under FFPSA to draw down funds. Now, again, I'd be remiss to say that in the state of California, family resource centers are now defined in the state. So family resource centers can receive state funds, and we've been able to do that, although there hasn't been any allocated recently. And this last year, they have been named in federal funds. So under Title IV family resource centers are also available for Title IV funds too, which adds another layer to the FFPSA plans, if you will, than when they were first approved. That wasn't the case, but it is now. And as Michael Williams, who's on, will tell you, that we're in the state capitol. I'll be up there next week to get the state words completely aligned with the federal words, so that we're all working together. Even though we did it first, the feds say yeah, and so now we have to get them to be more aligned together. But we're working on that. And so you have opportunities, again, as you're engaging, to use agencies that can draw down funds, not just the resources that they have available through other contracts.
I think this is a nice transition to the next question, which is something we've been exploring at the Alliance too, is what work is being done on making sure that the CBOs who are trusted and relevant to the communities culturally are the same CBOs contracted by the agencies, and that the culturally responsive services that may not be EBPs are also utilized.
Ooh, great question. Great question. And so I will tell you, um, my personal answer to that is have no clue. It's up to you and your county. Because every county approaches the relationships with CBOs completely differently. There is no, you keep hearing me talk about family resource centers. There's no family resource center structure across the state of California. Nothing consistent. Every county handles it different. Every county handles its relationships with CBOs and how it delivers many kinds of services, not just some of the obvious ones like child welfare and behavioral health. They have different approaches. Some only use county staff. Some only use primarily CBO staff. So it really is county to county at this point in time, and unless the state decides to create some alignment. And then the county, then, of course, depending on how your county looks at this, you've got audit trails, you've got organizational accreditation. So many CBOs are accredited, and there are a number of very good accrediting bodies that organizations use in the child welfare arena, the family serving arena, that you could use as a kind of a bottom tier to get to. And then, of course, it's all about responsiveness and relationships. So for me, my answer is like it all just depends. And particularly those in the rural communities, you may only have one or two CBOs available to you. So how you may be working on, how do I strengthen the CBOs that are in my community? Maybe we want to be able to do more with you, but you need to be accredited, or we need you to have these kinds of standards, or be delivering these evidence-based practices, and be able to share for 6 months that you've done that well, and that we're going to do an annual review to make sure that we're doing quote unquote fidelity to the model. We all know those words again, but that's there isn't any statewide standard at all. Adrienne, right? Nothing.
Yeah.
Nothing. Nothing.
Laurel, any other comments you wanted to make on that one? I think it's like really a central tension slash question.
Yeah.
Questions, multiple questions. Anything else you wanted to add on that, or anything you're seeing?
I, I would just say, given what we heard in the first panel thing around our Native American and African American families and the need to have culturally responsive services as well as community-based organizations that they trust at the table, that
Yep.
that's something that every county really needs to be focused on to make these community pathways different than what we've seen for the last 20 years.
100%. And they should be reflected. So again, you've heard me. Thank you, Laurel. Really appreciate that. And you've heard
Yeah.
me kind of allude to it in some ways as I talk to just even urban versus rural. Are is radically different. And so when we get into the context of that, we're providing services in LA County. There's every community has its own context. And each county has multiple contexts. And so how do we lift organizations, or how do we encourage organizations that are CBOs to be more accountable to and reflective of the communities they're serving? That's really the piece that can happen. I don't know of any other approach at this point in time. You can legislate it through your contractual arrangements that you're going to have a certain number of people that can speak certain languages, et cetera, et cetera. That happens all the time. But it really, we also know that honestly, the best thing to happen is to have staff that are reflective of the communities that they're serving. Just as a CBO, that really is very critical and very, very helpful on every front. Yvette, you have your hand up. Go ahead.
I do. I do. I just wanted to just add my voice to everything you said, Ron, and everyone else has said. I'm part of the Citizen Review Panel for Prevention, and we have been drumming that, beating that drum for the last 6 years to CDSS, and we there are many members that have come and go on that panel that have been frustrated by kind of the lack of the attention to the individual needs, the grassroots organizations that are available to meet the cultural and trust needs of the community. And so I just really encourage everyone to, and that's why I put in kind of a comment a little bit ago, that we can't keep the same structure that we have, for the past 50 years. We do have to change. And that change has to include trusted partners for communities that are overrepresented in the population of children that are coming into child welfare.
100%. Thank you so much, Yvette. And I know some of the
Yeah.
partners on that panel with you. So, but you're absolutely right. And one of the things I could say I'm seeing happening in the dynamics as we're looking at community pathways is we have been lifting community voice on a regular basis. Community representation has increased dramatically in the last 5 years. Post-pandemic is the best way to put it. I mean, we talked about it going into the pandemic, but coming out of the pandemic, we have seen huge efforts to make sure that there's community voice, whether that community voice is LGBTQ, whether that's indigenous, whether that's whatever the population, transitional age youth, and actually, foster youth that are transitioning out of foster care. I mean, there's a whole lot of opportunities for us to be intentional. And so really, we can't be passive about this. We have to be intentional. And so when we talk about trusted CBOs, they aren't necessarily going to be the ones that you always worked with, or that you've traditionally contracted with. They may be those, but they also may be those that are working to lift other CBOs in the community, so that you're lifting ones that are serving more specific populations that really do need help. And how do you lift those up too? So how do we, we've taken the approach in my organization is we'll get a big grant, but we have to be able to subcontract out and partner with, because we only have the face that we have and the community voice that we have, and we can draw that up, but we're not going to be able to draw all the community voice in the context of this huge county, etc. So really how do we partner with organizations? Because we can't all be everything to everyone. So it's going to take collaboration. And to use a phrase that the Child Welfare League hated when I wrote a document for them, like nonprofits suck at collaboration, but we're getting better. So we are getting better. And you all on the government side need to force us to be better too. You need to tell us, like, no, you're really good here, but you're not good here. You can partner with somebody. Make that an opportunity. We used to get all these grants that are single sourced and you have to do all the delivery. No. That's a especially when you're serving a population that has like five different contexts in it. Like just know you have an opportunity to help facilitate this type of engagement, as well as the fact that we're seeing it happening. And again, in Community Pathways 201, you're going to see some of that community engagement in spades. Michael, I've done a really good job pitching your class, by the way. Thank you.
Yeah, Michael, anything you wanted to add about what's coming up? We really want folks to be
Yeah,
like
boy, now we got a
joining your
lot to live
session.
up to here. So this is great. Yeah, we definitely are going to be talking about that second path, the mandate reporting to community supporting. An amazing example through Shields for Families. They're doing the plans of safe care with partnering with hospitals. And I'll just echo what we were hearing in the chat that funding is an issue because if you want to completely avert families being on the radar of child welfare, and then there isn't someone from child welfare to approve FFPS. So the plans of safe care have a grant. We'll be talking about legislation for pilot projects, hopefully to establish funding for this kind of role. And I know we're going to have to catch recordings of some of the other sessions because I think there are some good sessions going on right now around creative funding, especially through CalAIM and Medi-Cal and other events, because it will take creativity and we're advocating. So you're going to get a deep dive into folks who are doing an amazing job, and then a picture of where we're trying to take it on a policy level.
Adrienne, are there any other questions?
Not a question, but I wanted to highlight, well, there are some questions, but I did want to highlight that Lauren put in the chat that Humboldt has 20 community pathway sites that include local tribes and family resource centers.
Yeah, there you
And
go.
there's a
I know
link
that.
here.
Yeah, Humboldt's been doing some really, really great work, and we've been hearing a lot about it. Yeah, and just so
Yeah.
you guys know, but Humboldt know, I've been down here in LA lifting you up all the time. So thank you. Really cool stuff. And of course, here we are. The funny thing is this, like we're in a transition period. So one of the reasons why we wanted to take this 101 approach was to say, if you just went to 201, you're going to miss the FFPSA portion and maybe still be a little bit confused because Title 4E doesn't necessarily mean community pathway under MRCS. So like how we wanted to make sure that you're able to divide those two things and say, this is this, even though some of the organizations are going to be the same. So we're in this kind of murky territory that we want to provide clarity because we're also in a period of transition. So big transition. So as MRCS is coming about, and it will come about, we will end up with technological tools that allow mandated reporters to absolutely make a referral once they use a decision tree that are there and available, and they could evidence they use it, that they have resources available to them, and those are in a technological platform that they can reach out to, and they can just do a follow-up real quickly to make sure that it was received on the other end and there was a contact made. That's all they really need to do. But all that's in transition right now. Just like, yes, we've had FFPSA plans since 2023, and we still can't bill the federal government for it yet because we don't have the billing system in the state of California built. So almost done. But this is a really, really exciting time for us. A really exciting time for you to be on the front end of how do we think differently in the whole child welfare arena. How do we keep kids out of the child welfare system in the first place? What other avenues are available? What else is missing in your county that you can support, whether you're a CBO or a government entity? And are you guys linking together? Are you talking to each other? I have seen radical change in the last 9 years of communication between government and non-government entities, and even government entities talking to each other. Radical change, way, way more improved. And that's the systems change that we need to be making ourselves. That we need to adopt the kind of system change that's like, look, we're all in this together. And we all want kids to have a chance to grow. We all want them to be healthy. We want our families to be supported. We want to take the systems that are there and available to us and improve them so that people have access and they're clear and that the outliers don't exist, that every context of our community that's out there, whatever, however we define it, has an outlet and an opportunity to be successful and to deal with issues that are going on in the families. Because you know what? It doesn't seem like it's getting any better outside of the state of California. So can't we just take care of ourselves for a little bit? Maybe that's what we need to be doing. I'm just no politics there, but I'm just saying, we've made some huge strides, and I'm really excited at those strides. I'm just really want to be thankful to all of you. One, you're here, you're listening, you're attending these things, you're trying to figure out how best to move your county and your organizations together collectively. Collectively is the way to do it. And so just live with that.
I see Edward's hand. Maybe we take a few more questions. I think we have a few more minutes, right, Ron?
Yeah,
Right,
we've got 8 minutes before we have to boot you.
Okay,
Thanks. I want
Edward.
to go back to the concept of mandatory reporting to community support and what requirements there are in terms of the counties. I see that, I understand that shift. That shift is also implying a lot more critical thinking to be done on the mandated reporter. And counties I see are providing these guides, which as an analyst, my first thought is liability in terms of providing these guides. And so I want to go back to the question that I had in terms of what is the criteria around having these guides available for mandated reporters to be able to make that decision, which we all know it's a legal decision too, right? If you do not report, then there are consequences to
That's
that.
right.
So yeah, what is the required guidance for counties to be able to provide these things as we approach community pathways and building that structure?
So right now, to my knowledge, the issue is that it's in legislation. So that's the piece that allows for it. There's legislation right now about some more pilot work, and that it really does depend on county council and county council's ability to acknowledge this. There has been pushback on MRCS work, and for the very reasons that you're saying. But I don't know that I would say that this approach actually should, if we're doing it right through a decision tree, actually takes less critical thinking skills, and is far more simplistic than it is at the moment. Because right now it can be considered very arbitrary, and we all know, like as I said from the very beginning, the opt-in is if it's even 1% looks like risk, I'm going to report it. And so the whole idea is how to move away from that. And we also know that that generally comes from our public services sector and our education sector. Those are the two primaries. And so it's there. So thanks, Michael. He put the legislation in there that's going to address this. So it will come out of legislation. Eventually, it's going to come out of legislation. So that's the driver. Right now, I'm trying to provide clarity so you're hearing the language and the testing models that are going on. But eventually, it'll come out of state legislation, and that's what will provide the coverage, the risk coverage, and the fact that people can evidence they used a tool that's been established by whatever entity. So I don't even know what entities are out there doing that at the moment. Our friend Lauren might know better than I do because they've got a process that they're using. Yes. So Safe Passage at Humboldt did a lot of work on decision trees many years ago. Yeah. So it's really that. So there is no right answer right now, Edward. There isn't one. It's the hard part is we're back still in the middle of this, but it is moving. And if I was a betting man, we're not going back. It's only going forward. It's not going backwards.
Ron, there's a couple of people who have the same question in the chat about mandated reporters. Can they refer directly to the community pathway? Their
Well,
understand. Oh, go ahead.
yeah. So my understanding at the moment is if you have a decision tool that's been adopted, even in a pilot structure, yes, you can after you've used the tool. If you don't have a tool, it's my understanding that that's a gray area at this point in time, and that you should be working with legal counsel wherever you work or whatever your county's approach is at the moment. But I'm not going to be here and tell somebody that not to report and just to go right to a community pathway when they might lose their license or their credentials. I do know that there are counties that are using a decision tree and that that threat has been removed. But it needs to be under the structure of a decision tree and an evidence of a decision tree model, to my knowledge at this point. So what you hear me saying is, if you're not using a decision tree, you still need to be doing reporting until this gets to the next place. But the words community pathway are here, and have been under FFPSA, and they are coming and will be here under MRCS.
I want to make sure in our last couple of minutes, were there any questions that folks wanted to draw attention to in the chat that I may have missed, or anything else you have a question about that we haven't covered? We have a couple more minutes.
I just want to agree with Tally. It's going to be interesting to see what documentation will be required to back up the decision to refer to CBO. Totally. And that's all in process right now. And you can bet there's going to be a lot of legal beagles on all of this, and there's going to be legal issues at the state, even in discussions as there have been, even with our public security and public services people concerned about this too. Anything else? Anything else we can help with? Yvette, go ahead. You took yourself.
No, I was just thinking and was going to say, but it'll be worth it, right? Not to have children and families being disrupted and the trauma that causes.
Totally worth it. 100%. Thank you for pointing that. And that's the whole point of it, right? That is the whole point. The trauma that happens. Yeah.
I put Ron's and my email in the chat. Would love to have any follow-up as needed, as desired. I love this conversation and the engagement. It actually helped me in terms of talking about these issues in the future, about like adding some more content. Ron, I'm thinking, some more clarification. This has been really helpful in terms of what some of the questions are and challenges.
Yeah, we'll go back afterwards under the tape and analyze it too and see if there's more that we can get out. We are supposed to be looking at where are the decision trees. We know one. Are there any more? Just thank you all for your patience and attendance today. Adrienne and I did this because we thought it was important. We thought it was a component that's missing out there, and we wanted to set up Michael in the next one well, but also to provide some clarity where there's some gray area, and also to give you some hope, because that's what this does. It gives hope to the families and the children that you're all serving, and people and families that are struggling financially, that maybe don't need to enter this world in a different kind of way, that can get some resources that are out there and waiting for them. So really appreciate all the work that each and every one of you do every day for the children and families across our state and in every corner of our state, by the way. You're worth it. Thank you.